Hello everybody. Today I'll talk about the muscular system. Muscular system refers to the skeletal muscles of your body. And you know that skeletal muscles are voluntary muscles, and with the help of the skeletal muscles we move our body parts. So skeletal muscles are attached to the skeleton, mostly attached to the bones or the skeleton of the body. Also, in the body wall, you have the skeletal muscles. For example, abdominal wall is formed by the skeletal muscles. Also, in some sphincters in your body, you have the skeletal muscles. So, skeletal muscles also form some sphincters, and the contraction of the sphincters and relaxation of the sphincters can be controlled voluntarily. For example, the external anal sphincter or external urethral sphincter you can control during defecation, during urination. So those are the skeletal muscles and their locations. So first we'll talk about the functional group of the skeletal muscles. Then we'll talk about how we name the skeletal muscles of the body. Then we'll talk about the direction or arrangement of the muscle fibers or fascicles inside the skeletal muscles. Then we'll see the major skeletal muscles of the body, the skeletal muscles in different parts of your body. Then we'll talk about the muscles of facial expression, muscles of mastication. Those are the muscles present in the face. Then we'll talk about the respiratory muscles help in breathing, abdominal muscles from the wall of the abdomen, and abdominal muscles help in a number of things like forceful breathing, defecation, urination, parturition or childbirth, sneezing, vomiting, screaming. So those actions are helped by the abdominal muscles. Those actions need increase intra-abdominal pressure, and your abdominal muscles can be used to do that. Then we'll talk about the pelvic muscles from the pelvic floor, and pelvic muscles actually surround the outlets of your anal canal and urethra, as well as other outlets of the body. First, functional groups. We divide the muscles into 4 functional groups based on the type of functions they perform. Prime movers are the main muscles, the primary muscles for a particular movement. For example, when you flex your forearm, the biceps brachii is the main muscle that causes the flexion of the forearm. Biceps brachii is the prime mover. Antagonists. Antagonists are the muscles that act against the agonists. So now prime movers are the main muscles for a particular action, and agonists are the all muscles for that particular movement. For example, when you do the flexion of your forearm, so this is your forearm, okay, this is your forearm, this is your arm, okay, and this is your biceps brachii muscle here. So this is biceps. So to do the flexion of the forearm, biceps is the prime mover, because that is the main muscle for that action. So biceps brachii is the prime mover. And under the biceps brachii, there is another muscle that is called brachialis. And also there is another muscle called brachioradialis. So those also help to do the same movement. So all those muscles cause the flexion of the forearm. So brachialis, brachioradialis. So you see here, to do the flexion of your forearm, biceps brachii, brachialis, brachioradialis, all these muscles work to cause that action or movement. However, biceps brachii is the main one. So this is the prime mover. Okay. And since all these cause the same movement, work together, all these are called agonists and working together. So all three are what? Agonists to do the flexion of the forearm. However, biceps brachii is the main one. That's why it is called the prime mover. And these two are doing what? Helping, assisting. And these are called synergists. Synergists, the helpers or assistants. So if, like, for that flexion of the forearm, if I say that biceps brachii gives 60% force, brachialis gives 30%, and brachioradialis gives 10%. Make sense? So all these together are causing that movement. That's why all these are what? Agonists. However, this one is giving the main force. So this is the prime mover. And these two are assisting. So these two are synergists. Okay. Then antagonists. Antagonists are the muscles cause the opposite action of the agonists. So these are the agonists here. They cause the flexion of the forearm. In the back of your arm, you have triceps brachii, and triceps brachii causes what? Extension, opposite movement. Okay. So triceps in this case is the antagonist. Antagonist. Make sense? If I talk about, you have to make it clear that you understand. So again, this is arm, this is your forearm. Okay. So here is biceps brachii, brachioradialis, and brachialis, and here is the triceps in the back of the arm. Okay. So now if I want to do the extension of the forearm, I have to contract the triceps, right? So for the extension of the forearm, triceps is the agonist and prime mover. Make sense? So we are talking about which movement, that is important. For the flexion, biceps brachii is the prime mover and all those are agonists. If I talk about the extension, then who is the prime mover and agonist? The triceps. Okay. And who are the antagonists? These three antagonists. Okay, so you see, same muscle could be agonist or antagonist. It depends on which action or which movement we are talking about. Make sense? And synergists help or assist the prime mover as well as help to prevent undesirable or unnecessary movement. When you do the flexion of your forearm, these muscles help, right, cause the movement. However, your deltoid muscle, trapezius, pectoralis major, those muscles do what? Prevent the undesirable movement of the muscles, the agonists. So those are also synergists. So synergists do two things: add additional force or assist by adding additional force, as well as prevent undesirable, unnecessary, unwanted movement. Okay, so the movement will be more precise and powerful. Like when you are doing flexion of your forearm, right? If the shoulder moves, then that movement will not be precise. Make sense? So to prevent the movement of the shoulder, you use the pectoralis muscle, deltoid, trapezius, those muscles stabilize the shoulder. Then your forearm movement will be more precise and forceful and strong. Okay. Fixators. Fixators stabilize the origin of a muscle. For example, again, this is your forearm and this is the main muscle, okay, for the flexion of the forearm. And if any muscle just gets attached to the origin of this muscle, starting of this muscle, and ties it strongly to the bone, fixators stabilize the origin of the muscle that is causing the action. So those are four groups of the muscles based on their functions. Now, naming of the skeletal muscles. We name different skeletal muscles differently based on a number of things. Some muscles are named by location. For example, temporalis, attached to the temporal bone, or it is actually over the temporal bone. So that is temporalis. Another example is pectoralis. Pectoralis, pectoralis means chest, pectoral. So pectoralis is in the chest. Occipitalis, frontalis, in the frontal area, frontalis. In the occipital, back of the head, occipitalis, right? So those are named after the location. Then another example, tibialis anterior is a muscle. Why it is called tibialis anterior? Because of its location. It is located in front of or anterior to the tibia. So some muscles are named by the location. Some muscles are named after the shape of that muscle. For example, deltoid, triangular muscle in the upper part of your arm, helps in the shoulder movement. Trapezoid, trapezius. Trapezius is a big muscle in the back of your trunk, kite-shaped muscle, named after its shape, trapezoid shape. Rhomboideus major, rhomboideus minor, rhomboid shaped. Okay, so by shape, some muscles are named. Some muscles are named after the relative size. Maximus, gluteus maximus, the largest one in the gluteal area, in the buttock area. Then you have another one there, gluteus medius, the medium sized. Gluteus minimus, the smallest one, right? So based on the size. Also, we use the term longus and brevis. Longus means long. So if the muscle is long, we say longus. If it is short, we use the term brevis. Okay. Direction of the fibers or fascicles. Sometimes we name the muscle by the direction of the fibers or fascicles inside it. Round muscles around your eye or mouth, if you see inside the muscle, the fibers are circular. So that is called orbicularis. If you see the fibers are straight in a muscle, that is called rectus. So this is orbicularis, means round or circular fibers. Example, orbicularis oris, around the mouth, orbicularis oculi, around the eye. Rectus is straight, rectus femoris, rectus abdominis. Rectus means straight. Okay. Oblique, external oblique, internal oblique in your abdomen. So the fibers are not straight, not transverse, but oblique like this. So this is oblique. Makes sense? This is also oblique this way. So it could be either this way or that way. Both are oblique. Transverse. If you see the muscle fibers are like this, transverse. Transverse as abdominis. So you see a number of muscles are named after the direction of the fibers inside them. Number of origin. Biceps brachii, triceps. Biceps brachii is the muscle of the front of your arm. Why it is called biceps? Bi means two. It has two heads or origins. Triceps, tri means three, in the back of the arm. Attachment. By looking at the attachment, also some muscles are named. For example, sternocleidomastoid, a good one. Sternocleidomastoid, a big muscle in the front of the neck. And why it is called sternocleidomastoid? Because this muscle has two lower ends and one upper ends like this. So two lower ends, one is attached to the sternum, another is attached to the clavicle. Okay, so sternum, clavicle, that's why sternocleido indicates clavicle, and upper end is attached to the mastoid process of the temporal bone. So you see sternocleidomastoid. Three attachment to lower sternum, clavicle, and upper end is attached to the mastoid process. Okay. Action. Many muscles are named by their actions. Flexor. You will see a number of flexor muscles like flexor carpi ulnaris, flexor carpi radialis, flexor digitorum. Also extensors. Those muscles cause extension. Some of those muscles are named as extensor. For example, extensor digitorum, extensor carpi radialis, extensor carpi ulnaris. Okay. So by the action, abductor, adductor longus, adductor magnus. Why they are called adductor? They do adduction. Adduction is an action. Uh, Pronator, supinator, all those names are based on the actions. So you see that different muscles are named based on a number of things. Here, the arrangement of muscle fascicles. As I told you, circular is orbicularis. Example is orbicularis oris, around the mouth. Okay. In some muscles, you will see the muscle fibers are parallel. So that is another type of arrangement of muscle fibers. Good example, sartorius. In the front of the thigh, there is a nice muscle, and inside it, the fibers are parallel. convergent. You see here, the convergent, good example is pectoralis major, this muscle in the front of the chest. Why it is called, the fibers are called convergent type fibers? Because you see, they come from different ribs, origin from different ribs, the muscle fibers, and get together here in the armpit area. Okay, so that's why it is called convergent, coming from different directions and getting together at one point. Okay, like this, coming from different origins but getting together at one point, that is called convergence. Okay. Then unipinate. If you see that the muscle is present in one side of the tendon, this is a tendon inside the muscle, and if you see that muscle fibers arise from one side of the tendon, so the muscle is only in one side, not in both sides. That's why it is called unipinate. Pinnate is the arrangement of the leaves in the plant. You see, in the plants, the leaves have different shapes, right? Sometimes you'll see the stem is like this. This is the stem, and leaf is only in one side, like this. So this is unipinnate leaf. So unipinnate leaf, or same way, unipinnate muscle. If you see, the stem is here. In case of muscle, the tendon is there, and fibers arise from both sides, that is bipinnate. So this is a good example of bipinnate. See, the tendon is in the middle. Okay. Fusiform. If you see, the muscle fibers are like this, like your eye. Both ends are pointed or tapered, and muscle fibers are like this. So this is spindle shaped, okay, muscle. So that is fusiform. And multipinnate. If you see, inside the muscle there are multiple, more than one tendons, and the muscle is like this. So this is one muscle, but a number of tendons, more than one tendons, like this inside. So this is one muscle that is called multipinnate. So unipinnate, bipinnate, multipinnate. Okay. Now we'll talk about the muscles, the major muscles of your head. So you know that the head part has two groups of muscles, the cranial muscles and the facial muscles. Cranial muscles are attached to the cranial bones, and facial muscles are attached to the facial bones. So the important cranial muscles are temporalis in both sides of your skull, over the temporal bones. Okay, and temporalis muscle gets attached to the upper part of the mandible, so it helps in the movement of the mandible. Okay, so that is a muscle of mastication, helps in the movement of the mandible, although it originates from the temporal bone, but the lower end gets attached to the mandible and helps in the movement of the mandible. Makes sense? And that means it helps in mastication, chewing the food. Occipitofrontalis is a muscle that has two bellies. On the frontal bone, in the frontal area, you have frontal belly. In the back of the head, you have the occipital belly, and they are connected by a white connective tissue membrane or sheet that is called epicranial aponeurosis or gala aponeuretica. Okay, and occipitalis and frontalis, developmentally, they are not two separate muscles. one muscle, although two separate bellies. And this muscle, occipitofrontalis, together called occipitofrontalis, this muscle helps to move the scalp slightly forward and backward. Also, you can squeeze your skin of the forearm with the help of this muscle. You can move the eyebrow upwards also with the help of this muscle. So that is occipitofrontalis. Now, in your face, you have several muscles. Those are relatively smaller, but they perform a number of important functions. Important functions are some facial muscles help in facial expressions. You know, facial expressions or facial expressions change when you are happy, right? Happy face, sad face, angry face, right? So those are the facial expressions given by some facial muscles. Some facial muscles help to move the mandible. That means help to masticate, mastication, chewing the food, right? Very important. Also, those muscles help you to move the mandible, help in speaking, speech, right? We move the mandible to speak. So, those are the main functions of your facial muscles. Now, important facial muscles are orbicularis oculi, round muscle around the eye. Oculi means eye, orbicularis is round. Levator labii superioris, levator labii inferioris. Levator indicate lifting up. So when you will hear levator, just think elevator, lifting upwards. Okay. Labii means lip, superioris means above, inferioris means below. So if you just think a little bit, you can understand the function and where these muscles are located. Zygomaticus major, zygomaticus minor, both are attached to the cheekbone, zygomatic bone. The bigger one is major, smaller one is minor. Make sense? Buccinator or buccinator. Some people say buccinator. You know, buccal area means cheek. So cheek area is called buccal area. So buccinator is in the cheek. And this muscle, orbicularis oris, again orbicularis is round, right? And oris means mouth, oral, came from oral, mouth. So orbicularis oculi, oculi means eye, oris refers to the mouth. Okay. Masseter, masseter is the strongest muscle of the face, and this is the main muscle of mastication. If you want to crush something hard like bone, okay, you use this muscle because this is a very strong, powerful muscle. When you clench your teeth, you can actually feel with your finger or hand that muscle gets very strong, hard. Okay, so that is the masseter. Depressor, depressor moves down. Okay, moves down. Anguli oris, oris is oral, mouth. Anguli is the angle of the mouth. Okay, and risorius, risorius is the muscle that widens the mouth. So attached to the both sides of the mouth, if this is the mouth, this is risorius, attached to the both sides of the mouth, and when they contract, they will do what? They will widen the mouth. So help in smiling. So let's see those muscles. So I have removed the names so you can just learn better. So you see here, this muscle is around the eye, right? So this is the orbicularis. Orbicularis means round. Oculi, okay, orbicularis, oculi. Oculi means eye. And under the orbicularis oculi, you see this muscle. You will only see it once you remove or dissect the orbicularis oculi. This is called corrugator supercilii or corrugator supercilii, okay, muscle. So those are two muscles around the eye, okay. And let's see the cranial muscles first. So this is the frontal belly of occipitofrontalis. This is the occipital belly of occipitofrontalis, and this white connective tissue sheet connects two bellies. This is called epicranial aponeurosis or gala aponeuretica. Okay, so frontal belly, occipital belly, and this is gala aponeuretica or epicranial aponeurosis. And this is actually developmentally one muscle, single muscle. And this is temporalis, over the temporal bone. Okay, I mentioned that the lower end here you see attached to the mandible, so it helps to move the mandible and helps in mastication. Okay, so this is temporalis. And I already mentioned this is around the eye, orbicularis oculi. Oculi is eye and orbicularis is round, sphincter like muscle, and under that you have corrugator supercilii or supercilii. Then let's see another round muscle around the mouth, this one. So this is called the orbicularis oris, kissing muscle. Okay, so that helps you when you kiss, that muscle helps. Then you see these two muscles here, this one and this one, both are attached to the zygomatic bone, right? So this is zygomaticus major, this is zygomaticus minor. So two muscles here, both are zygomaticus because they are attached to the zygomatic bone, major and minor. Okay, then we'll see the strongest muscle of the face, this one. This is called masseter. Okay, the strongest muscle of the face is the masseter. Strong, clench or bite to crush the food, hard food. Okay, then we'll see the muscles around the mouth. So this is the mouth, so around the mouth. First let's see below the mouth. The chin area is called what? Mental area, right? So this muscle is the mentalis muscle here. Okay, mentalis. Very easy by its location. Then next is this one. This muscle is called depressor labii inferioris. Now just think that three parts. Depressor, when this muscle contracts, it depresses. Depresses what? Labii, lip, the lower lip. Makes sense. It is below the lower lip, right? So when this muscle will contract, it will pull the lower lip downwards. That's why it is depressor labii. And it is located inferior. That's why inferioris. Okay. And this one, you see, this muscle is attached to the angle of the mouth, right? And downwards, going downwards. So when this muscle contracts, it will pull the angle of the mouth downwards, right? That's why it is called depressor. Again, downwards. Anguli oris. Anguli, angle of oris is mouth. So this is depressor anguli oris. Make sense? Then let's see this muscle. You see this one is attached to the upper lip and it is located just above the upper lip. And when this muscle contracts, it pulls the upper lip upwards, lifts. So levator, levi, superioris. Why superioris? It is above the lip. Okay. And why levator? It lifts or moves the lip upwards. Okay. So those are some important facial muscles, and this is the one. You see the part of it is here. This is the buccinator or buccinator. This muscle helps in whistling, okay, or sucking. When you suck something, this muscle, you can actually feel this muscle, and this muscle works. So those are the muscles of your face. Okay. Then we'll see uh, this muscle. This is a thin, flat muscle that covers the anterior of your neck. So the whole anterior part of your neck is covered by this thin muscle that is called platysma. So this is platysma. It wraps down from the mandible here, okay, and gets inserted to the chest and chest muscle like pectoralis major and deltoid mainly, okay, the fascia of those muscles. So it is a thin layer of muscle, okay, platysma. Now this muscle, this is a muscle in both sides of the front of the neck, and you can clearly see this muscle when you turn your head sideways. It gets more clear, prominent, and these are sternocleidomastoid. Okay, this muscle is a big muscle, kite-shaped muscle in the back of your trunk. You only can see the upper part of it here, and this is called trapezius. Okay, trapezius. So those are the main muscles in the head and neck part of your body. Okay. Now, four muscles help in mastication. So those are called the muscles of mastication. One I already mentioned, that comes from the skull, the temporalis, right? And I also mentioned masseter, the strongest muscle of the face. And these are superficial muscles you can see from outside, and you have seen already in the pictures. Now these two muscles are attached to the mandible and help to move the mandible for mastication, but these are deep muscles. You won't see them unless you remove the superficial muscles. Okay, two pterygoids, medial pterygoids and lateral pterygoids, two pairs. So those are the muscles of mastications. Okay, here you see temporalis, masseter, and now you don't see the pterygoids here because they are the deep muscles. Now if you remove the masseter here, you see, if you dissect the masseter, under the masseter you will be able to see the pterygoids. Okay, lateral pterygoid, medial pterygoid. You see all these are attached to the mandible. Make sense? So masseter, lateral and medial pterygoids, they are attached to the mandible, as well as the temporalis come from the temporal bone here and get attached to the mandible. Okay, so these are the muscles of mastication. Now we'll see the muscles help to move the tongue. Movement of your tongue is extremely important. You know that by moving your tongue, you mix the food with saliva, right? You also make the food bolus and swallow the food with the help of the tongue, right? So movement, when you speak, you move the tongue, you twist the tongue. So movement of your tongue is very important. Therefore, many muscles get attached to the tongue. They come from the adjacent bones. Some of them come from, the temporal bone. Some of them come from the mandible. Some of them come from the hyoid bone. You see those three bones you can clearly see here. This is the temporal bone. So some muscles come from temporal. This is the mandible. This is the hyoid. Okay. One thing, just remember that uh, most of the tongue muscles end with the name end with glossus. Glossus means tongue. Okay. So styloglossus, hyoglossus. Why it is called styloglossus? If you just think, it is really easy, because this one is the styloid process of the temporal bone. You remember the sharp pointed process. So it goes from the styloid process to the tongue. That's why it is called styloglossus. Okay. Hyoglossus, from the hyoid bone to the tongue, to the glossus. That's why hyoglossus. Okay. So just know that most of the tongue muscles end with the word glossus. So in your exam, if I ask you which one is a muscle to move the tongue, if you see glossus at the end, that is of course a muscle to move the tongue. Now we'll see the muscles in the front of your neck. Under the chin, this muscle is called the mylohyoid. Okay, mylohyoid. And this is the hyoid bone. This muscle is attached to the hyoid bone. Upper end is attached to the mandible. Okay, so this is a big muscle. And this mylohyoid is a deep muscle. In this side, you can see the superficial muscle, digastric. This is an important muscle too. So the main muscles under the chin or under the mandible, superficial is digastric and deep one is mylohyoid. So if you remove digastric, you will see the mylohyoid. Okay. Now let's see the front of the neck. You remember I said that the anterior of your neck is covered by a thin sheet of muscle that is called platysma. You don't see platysma here because it has been dissected, it has been removed to see the other muscles. So platysma actually covers the whole front of the neck. That is the one thin muscle in the front of the neck. Then this is the sternocleidomastoid. I already mentioned about this. You remember it has two lower ends. One is attached to the sternum, another is attached to the clavicle. That's why sternocleido, and the upper end is attached to the mastoid process of the temporal bone, sternocleidomastoid. Okay, and remember most of the other muscles get attached to the hyoid bone, because hyoid is the only bone that supports the anterior neck muscles. So hyoid bone supports the anterior neck muscles, and those muscles end with hyoid. So if you see the end part of that muscle is hyoid, that means anterior, definitely anterior neck muscle, because hyoid is the bone in the front of the neck. Okay, so you see here mylohyoid, stylohyoid, omohyoid, sternohyoid. Okay, sternohyoid, from the sternum to the hyoid bone, sternohyoid. Okay, so those are the main anterior neck muscles. The one I'm repeating again covers the whole anterior of the neck, thin muscle, that is called what? Platysma. Under the chin, under the mandible, you have digastric, and under the digastric you have mylohyoid, and in both sides you have sternocleidomastoid, right? And other muscles get supported by the hyoid bone. That's why they end with hyoid. Omohyoid, sternohyoid, those are thyrohyoid, those are the muscles of the front of the neck. Okay, so if you see the muscle ends with glossus, that means that helps to move the tongue. If you see the muscle ends with hyoid, that means the anterior neck muscle. In the back of the neck, the superficial muscle is the upper end of the trapezius that I showed you before. You probably remember. This is the trapezius, this one. If you remove the trapezius, then you can see the other muscles in the back of the neck. Under the trapezius, you have splenius capitis, splenius cervicis. So if you see the muscle starts with splenius, those are posterior neck muscles or the back muscles of the neck, okay, under the trapezius. Now, the muscles that help to keep the vertebral column or spine erected, okay, these muscles are really helpful to keep your body erected. Otherwise, body will get curved, okay, bent. So, to keep your body straight, you need to keep the spine or the vertebral column straight, right? So, the main muscles, those help you to keep the spine or the vertebral column erected. They are these muscles here. These three muscles together called the erector spine. You now understand the name, right? To keep the spine erected, straight. So three muscles bundled together to form the erector spine, or together is called the erector spine muscle. And what are those three? Iliocostalis, longissimus, and spinalis. Okay. So just remember that if I ask you which three muscles belong to the erector spine group, these are the three muscles. Okay. You have those muscles in this side of the spine or vertebral column too. So from both sides, they try to keep the spine erected. Okay. Muscles of the thorax. Now, the muscles of your thorax can be divided into two groups. Respiratory muscles are the muscles those are directly involved in breathing. Respiratory group or respiratory muscles. So which muscles directly help you breathing? Intercostals. There are two sets of intercostals. The outer layer is called the external and inner one is the internal. Inter means in between, costal means ribs. So in between the ribs. So these are the ribs, right? So if these are the ribs, in between the ribs you have intercostal muscles. Make sense? There are two. The direction of fibers is just opposite, kind of opposite direction. So one is external, the outer one, another is internal. And under the lung you have the diaphragm, which is also a muscle. So these three muscles directly help in breathing. That's why those are called the muscles of respiration or respiratory muscles. Okay. uh, the external intercostal and diaphragm, these two muscles help in normal breathing. Like when you inhale, these two muscles help. Okay. Contraction of external intercostal cause the elevation of the ribs, so the lung will expand forward and backward, anterior posteriorly, and diaphragm pulls the bottom of the lung from the bottom, so will expand the lung superior and inferiorly. So by the contraction of external intercostal and diaphragm, you expand the lung. That causes the inspiration or inhalation. Okay. And internal intercostal help you to forceful expiration. Okay. Opposite. Now, although these three muscles are called the muscles of respiration, remember that other chest muscles or thoracic muscles, as well as some shoulder and back of the shoulder muscles help you uh, to breathe. Those are actually the synergists, or they assist in breathing. For example, your pectoralis major also helps in breathing, however not directly, by putting additional force when necessary, when needed. Okay. uh, so those are the thoracic muscles, but we don't say those are the respiratory muscles. So here you see in between the ribs, external intercostal, the fibers are going like this, right, this way. And under this, if you remove this one, then you have internal, another layer, internal intercostal. So you see here that the fibers are going in opposite direction. So external is like this, internal is like this. Okay. So those are respiratory muscles. As well as the diaphragm. The muscles of the abdominal wall. In the abdominal wall, you have four muscles, two obliques. Why they are called obliques? Because the fibers are obliques, like this and this. Okay. And one is the inner one, in internal oblique, another is the external oblique, outer one, and then there is another muscle. The fibers are like this. That's why it is called transversus abdominis, in the abdomen. And another is rectus abdominis. The fibers are straight like this. Okay. So two obliques, one transverse and one rectus. Okay. So those are the muscles of the abdominal wall. So let's see here. First, let's see those four abdominal wall muscles. This one, you see the fibers are going straight down like this. So this muscle is called the rectus. Rectus means straight. Where? Located abdomen. So rectus abdominis in the middle of the front of the abdomen. Okay. Same thing in this side, but they have removed it. And this muscle makes six packs. Okay. And in the middle of this muscle, there is a white connective tissue structure that is called linea alba. Linea alba. Okay. And then, so this is rectus abdominis, this muscle, rectus abdominis. Okay. This one, the whole muscle. And these are the transverse lines, also connective tissue structures, and linea alba is this one. And then this is the external oblique. You see the fibers are like oblique, like this, and it is the outer one. That's why this is called external oblique. And under that, if you remove this one, you see the fibers are oblique but in opposite direction. So internal oblique. Okay. So external oblique, internal oblique, and then the deepest muscle, you see the fibers are transverse. This is called transversus abdominis. So again, this is the rectus abdominis, external oblique, internal oblique, transversus abdominis. Okay, so those are the four muscles in the wall of your abdomen. This is the lower part of pectoralis major, and this muscle, you see the front of this muscle gets serrated, like serrated knife, split, segmented. You see here also. That's why this muscle is called serratus anterior, attached to the ribs here. So serratus anterior. So pectoralis major and serratus anterior, those are not abdominal muscles, those are above the abdomen, right? So those are thoracic muscles, non-respiratory thoracic muscles. Okay. Muscles of the floor of the pelvic or pelvic floor muscles. Pelvic floor is very important because these muscles, pelvic floor muscles, seal a big opening between two hip bones. So the floor of your pelvic cavity is formed by these muscles. Pelvic floor is also called pelvic diaphragm, and two pairs of muscles form the pelvic floor, levator ani and coccygeus. Okay, and pelvic floor muscles are very important because these muscles, first I mentioned, that seal a big opening between two hip bones. Okay, so seals the inferior outlet of the pelvis, support the pelvic organs, right? From the bottom it forms the floor, so the pelvic organs are supported by the pelvic floor. Lift the pelvic floor to help release feces. So to increase the abdominal pressure, to release the feces, you lift the pelvic floor upwards. Okay, and if intra-abdominal pressure increases for some reason, then this pelvic floor will move down to provide more room to absorb that additional pressure. Okay, so if the pressure increases inside your abdomen, the pelvic floor will move downwards to give more space or room to to reduce the intra-abdominal pressure. So those are some very important functions. Also, the pelvic floor muscles are located around the sphincters, like urethral, opening, anal canal. Those are, surrounded by the pelvic floor muscles. So the pelvic floor muscles keep them constricted in normal time. You relax those muscles when you desire to urinate or defecate. Make sense? So here you see from the top, this is the pelvic floor. So you can see these are two muscles. This is the back, and this is back part is formed by this muscle coccygeus. Okay, and the front part by the levator ani. So levator ani has two muscles, pubococcygeus and iliococcygeus. Just remember levator ani in the front and the coccygeus in the back. Okay, and you can see here that the pelvic floor has the opening of the urethra, opening of the vagina, opening of the anal canal, and normally they will stay constricted. They should stay constricted, you understand, otherwise the urine will get out, right? Or the feces will get out. So they are kept constricted by the pelvic floor muscles. Very important. Okay, So let's stop here. Then we'll talk about the shoulder muscles and upper and lower limb muscles in next lecture. In this lecture, I talked about the arrangement of the muscles, right? Skeletal muscle fibers or fascicles. I talked about the naming of the skeletal muscles, how we name different skeletal muscles. We talked about the functional groups, prime movers, agonists, antagonists, synergists, fixators, right? We talked about those functional groups. Then we talked about the muscles of your trunk part of the body, the front of the trunk. We talked about the chest muscles or thoracic muscles, respiratory and non-respiratory muscles. We also talked about the abdominal wall muscles and pelvic floor muscles and their functions.